Hi, Dr. House here. Today I want to talk about a chemical brow lift. I just did a quick video on surgical brow lifts and upper blepharoplasty or skin removal, but there are ways to address the brow without surgery, and that's what we call a chemical brow lift. So on the face there's a constant tug of war balance between muscles. So there's muscles that pull up, there's muscles that pull down, and we can kind of use that to our advantage. So in this patient, we'll take a look at this patient. So in this patient, you can see that she has some heaviness of the lateral brow here and even the medial brow. And by placing Botox, which is a neuromodulator, it's botulinum toxin, it essentially disrupts the communication between the nerve and the muscle, so it tends to relax the muscle. So after usually between 7 and 10 days, you'll see the effects. So we place some Botox on her here, 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 and here, on the lateral part of the brow. On the medial part of the brow, this area is called the glabella. There's a muscle here called the procerus, and then there's also these two paired muscles called the corrugators. And so we place some Botox here and here, and here, here, and here. And what that does is essentially remove the strength from the low muscles that are pulling down and allow the upper muscles to win that tug of war. So essentially lifting the brow up this direction. So this is now the after photo. So the effects of the Botox is about 2 weeks after. And you can see that her brow has come up. The wrinkles around here are less because we've weakened that muscle, as well as in the central part of the glabella. But we are getting the effect of a chemical brow lift, meaning we're using injections to lift the brow. So I'll show you a comparison between the two afterwards, but you can see that there's a noticeable difference. She's got nice smoother skin around here, here, and then the center, the overall arch of the brow is a little bit more peaked laterally, which is what we like in women, a little bit like that. And I think she got a really nice result from that. So let's take a look at the before and after here side by side. So as you can see, before she's had that heaviness and the crow's feet. This is now softened quite a bit, and her whole brow has actually come up. You can see by a couple millimeters, and even medial here. So it opens up the eyes, it takes away some of that heaviness, both from a comfort standpoint for her, but also just aesthetically, it looks a lot nicer, and she's got a nice, smoother arch now, where before it was a little bit more horizontal in nature. So that's called a chemical brow lift. It's done with Botox, Dysport, any of the neuromodulating chemicals that we do use for that. And if you have any questions about that, or if you're interested, you want to come see me in clinic, just click the link below to the website, and I'll be happy to chat with you about that. All right, thanks a lot. Have a good day.